Thank you very much. It's always good to come back every year to explain. And it's in the media now, in the website. This is the annual report we published. And then this will be available. And half of this report has a data set of what we are doing, and half of them a narrative to explain how we are doing under a very difficult situation. And this is a sign of our pride. I'm very proud to come back to tell to the world that this is what we are doing. And it's amazing because say for example, I go to Gaza later, but since start of the war, we take care of the 8.5 million consultations since the start of the war, and it never stopped. And we have health centers functioning, medical points functioning. And the West Bank, because of also the atrocity in the northern part of West Bank, our health center still managed to cope with the needs of the patients. And we have 2 health centers in East Jerusalem. It's still functioning. So UNRWA stays deliver. And as the largest primary health care provider in Gaza and the second largest primary health care provider in West Bank, we still continue to deliver the care, taking care of the pregnant mothers, babies, immunizations, and diabetes, hypertension, anything that they need to seek to our health centers, as much as we can respond to them. So I'm very proud of this, and then I really appreciate that almost 3,000 health staff, but also 28,000 UNRWA staff. They continue to work under extraordinary difficult conditions. That's amazing. That's truly amazing. At the same time, Gaza is not sustainable. Those who came last year may remember I said that when I went to Gaza, today is worse than yesterday, and tomorrow is worse than today. And unfortunately, this never changed. Rick just left Gaza, so he can tell more. But my last visit in Gaza is the mid of January, before the anti-UNRWA Knesset bill took place. And it's still 3-4 months ago. But I really can't tell I know Gaza. It's totally different from the people. When we speak to the staff who are coming to work every day, they say that when I ask them, how are you? The answer is, I'm not good. Even the greeting level, I'm not good. And what are you thinking? I still remember one of the staff said, I'm thinking only 2 things: how to survive, how to die. This is truly unfortunate, and the shortage of everything, and the famous IPC report came out, and the malnutrition is on the rise. I have data from until the end of April, because May data we don't have yet. It shows the malnutrition is on the rise. It went down when the ceasefire happens. It went down, but now it's on the rise. And then the worry is that if the current food shortage continues, it's exponentially increase, and then beyond our control. Rick and myself visited Gaza many times before the war. We always enjoyed the nice people, nice food, nice environment in Gaza. It's unthinkable that 10% of kids are malnourished. It's unthinkable that we have severe malnourished children in Gaza, where they used to enjoy the life. And there's no life in Gaza. That's what our staff says so. And this will affect our operations. And then today, Luis mentioned the 9 health centers. Luis, sorry to say that I just heard that we have only 7 now. 2 closed, Ma'an, and then the other Hamad Health Center in Han Yunis closed because they fall into the evacuation zone. And so that every day it's different, and every day it's getting worse. But even at this time that we continue to provide the services, but we have 2 main problems. The one is security, which Luis introduced, but second is that the restriction of our movement and the transportation of the medicines. We use around 100 medicines in our primary health care, and 1/3 of them already stocked out, simply because nothing came in from the 2nd of March. If this continues in Gaza, that we face almost 50%, half of the medicine will be stocked out by the end of this month, and further on. And we have the largest primary health care provider in Gaza. Without medicine, what we can do? And then we have we have a common called medicine, but we have a life-saving medicine like insulin for the type 1 diabetes patient. Insulin is lifeline. Same for the hypertension and others. If we run out of medicine, whatever we do, people will suffer more, and it's totally unnecessary. If you go out of Gaza, in 1 kilometer, 2 kilometers, you can buy everything, without any problem. Inside Gaza, you can't find it. And as you can see in the backside of Louis' photo, we have plenty of medicine in Jordan that could solve, and plenty of food in Gaza, in Jordan, that could instantly solve all the suffering of the Gaza people to a large extent. If the borders are open, and then we can bring them in. And we are ready to bring everything in the pallet, everything in the truck. Once it's open, we can send all the medicines. It's totally frustrating. We see the stock out of medicine, but we couldn't bring in. And we are not allowed to bring anything with the name of ours. So because of Israel restriction. So that we are going to do, and that's the biggest problem. And I tell the world that please, let us bring all the medicine, the food, to solve the suffering of the Gaza people. Thank you.
Thank you very much, Dr. Seita.